My name is Rachel Wilson. I'm doing a report on a 16-year-old Native American female that I did a head, neck, eyes, ears, nose, throat, mouth evaluation on her. I'm going to start at the head. I palpated her head. She denied tenderness upon palpation. There was no bumps or lesions noted, no bruising. Her scalp was clean, no dryness, no visible signs of dandruff or dry scalp. Her hair, half of it was her natural color, which is black, on her left side, and the other half was a brown blonde mix. She had reported to me that she had bleached her hair, and that was accounted for the discoloration. I moved down to her face. Her facial nerve, cranial nerve number 7, was intact. Her trigeminal nerve, cranial nerve number 5, was intact. Palpated her temporal artery. There was no thrills. Palpated her sinuses, her frontal and maxillary as well. She denied tenderness, no discomfort upon palpation. Moved on to her eyes. Her eyes are dark brown. Her sclera was white. Her conjunctiva pink. Her eyelashes were full. There was no drainage. Her cornea was round, non-concave. There was no redness or irritation. Moved on to her nose. Her cranial nerves number 2, 3, 4, and 6 were all intact. Then moved on to her nose. Cranial nerve number 1 was intact. Her nasal mucosa was pink. Her septum non-deviated. Her nares were both patent. Moved on to her mouth. Assessed her buccal mucosa, hard palate, soft palate, tongue, gums, tonsils, all pink, moist. Denies any sores. There was no sores in her mouth. No exudate. Her cranial nerves number 10, 12, 9 were intact. Her mouth, her lips were moist, no dryness, no cracking, no redness. Assessed her ears. Her cranial nerve number 8 was intact. No drainage, no dryness, no redness, no irritation, non-tender. Assessed her throat. Her trachea was midline. There was no bruising, no redness, no irritation on her neck. I palpated her lymph nodes. They were palpable, non-tender, no nodules noted. Then I assessed her thyroid. It was non-enlarged, non-tender, and that concluded my assessment of her. And this concludes my report. Thank you.